Hi everyone, I'm Vanya.
And I'm Dimitri.
And today we're going to be talking about RCVS.
AKA Reversible Cerebral Vasoconstriction Syndrome.
Yep. And here are all the topics that we're going to be talking about. One, about the disease. RCVS is a rare neurological condition where the blood vessels in the brain dilate and they narrow, and this is called vasoconstriction, vasodilation. And parts of the brain that are affected, blood vessels. It can cause bleeding if too much blood is given and too less blood is given. And the cerebral cortex plays an important part of perception and memory and language. And the cerebellum, which is responsible for coordination and balance. So these two can be affected if less blood flow is given into the brain.
Now we have the medical diagnosis. So when physicians diagnose the patient with RCVS, they base it off of the patient's medical history, symptoms, and test results from an angiogram, an MRI, or a CTI. And an angiogram is an X-ray photo of lymph vessels.
So here's an example diagnosis. It will start out with the patient receiving many symptoms such as thunderclap headaches. They will later go to the hospital and get diagnosed after having a CTA, MRA, or an angiogram, and they will finally be diagnosed, and they will go under recovery and treatment with being carefully monitored after being given painkillers and medications to relieve the symptoms.
Now we have etiology. So here we have tumors in rare cases can make symptoms which can cause RCVS, extreme stress in which your body releases stress hormones which can affect your blood vessels, which can cause RCVS. Drug use from illegal and over-the-counter medications can cause RCVS, and people with a history of migraines may experience RCVS during and after migraine, and head trauma can disrupt blood vessel regulation, which can cause RCVS. So here we have severe headaches, strokes, difficulty speaking, and hypertension. All occur on the upper part of the body, and they all have this same kind of start of blood vessel regulation. So here we have some more symptoms, and we have our healthcare trends. So due to the fact that RCVS is receiving more awareness, there's more research going into RCVS and finding a cure for this disorder. 3 million adults are hospitalized every year with RCVS.
Related symptoms, just to note that. So here's some prevalence. So most 40-year-old people around in the middle of their stages of life are diagnosed with RCVS, and the gender that is most common to have RCVS is women by 75.5%. And
So 43% of patients diagnosed with RCVS have had past substance use. Most patients recover in 3 to 6 months, and women are 4 times more affected than men with this.
So here's the treatment. To prevent RCVS, there's no actual course, but here are some ways to avoid RCVS. So avoid drug use, avoid physical exertion, and avoid any triggering things that could trigger headaches. Treatment, rehab, and drugs. So rehab will be to rehab the patient's speech, movement, and substance management depending on what each patient needs to recover on and their medical history, and drugs to relieve the blood vessels, to relieve headaches, and decrease the risk of stroke. Conclusion. So this is everything you need to know about RCVS, and there will be a quiz on the next slide. So scan the QR code with your device, and you can take our quiz. Here are our citations, and those are all our citations. And thank you for listening.
From the Allied Neuro Scholars.